Victoria has set another national COVID case record. To our reporter in Melbourne in just a moment, but first let's take a look at the latest figures. 1,838 infections have been reported today and 5 people lost their lives. There are now over 16,000 active cases in the state. 55.6% of people over the age of 16 are now fully vaccinated, and 84.1% have received at least one dose, and restrictions will begin easing once the 70% threshold is passed. Well, let's go to our reporter in Melbourne now. Oliver Gordon joined us. Good morning, Oliver. Take us through these latest figures.
Hi, Ros. So 1,838 new infections and 5 deaths. It's a record for the state. It's the second time we've broken that record this week. Of course, on Tuesday we saw more than 1,700 people, 1,700 new cases. It means there are now more than 16,000 active cases in the state. That's another record. There are now more than 500 people in hospital, and we know only around 7% of those people are fully vaccinated. And when we look at the more than 10,000 cases that we've recorded over the last 7 days, health authorities tell us around 80% of those people catching COVID-19 are unvaccinated. We've heard health authorities and the Premier Daniel Andrews talk about this as a pandemic of the unvaccinated, and when we look at the new case numbers and how they relate to how many people have been vaccinated, we certainly start to see that becoming a reality. So 1,838 cases today in Victoria. It's a record that no one in Victoria wanted to see broken, but that's where we are.
Yeah. Oliver, police officers who were at the recent protests in Melbourne have tested positive.
Yeah, so the police union have confirmed that a number of police officers who were on duty during the large protests we saw last month have tested positive to coronavirus. We know at least one of those police officers is in hospital, and they have at some point yesterday been given assistance to breathe. Last month's protests, of course, started at the CFMEU offices in West Melbourne. A day later, we saw protesters walking along the Westgate Bridge, and then things culminated here where I am today at the Shrine of Remembrance. We all saw the pictures. We saw the protesters and police clashing. Some of the protesters were not wearing masks. Some of them were not vaccinated. Today we have tried to understand whether or not the police officers who contracted COVID-19 were vaccinated. We don't know. We haven't had that confirmation from the union. What we have from the union, though, is certainly a strong condemnation again of the protesters. They say police and their family members are put at risk when people protest in a pandemic, and this is proof of that.
And a school student is in ICU, Oliver, after attending an illegal gathering.
Yeah, so the ABC has seen a letter from the principal of St Columba's College in Essendon. That letter basically outlines the fact that there are some students from that college who have been attending illegal gatherings. 16th birthday party is what the principal is talking about, and in the letter it states that a 16-year-old student who was at that party has contracted COVID-19 and is now actually in ICU. We haven't had any updates on the well-being of that student, but the letter certainly encouraging members of the school community and their family to avoid gatherings until it is safe to gather again. It strongly encourages the families and the students to get vaccinated. It's obviously sympathetic to the fact that there are many milestones like 16th birthdays that can't be celebrated right now, but it really urges people to obey the rules. And as we know, many Victorians have lockdown fatigue at the moment, but this event, just another reminder that there is still some danger in getting together.
Yeah. Oliver, thank you for the update. New South Wales residents are set to enjoy even more freedoms from Monday after Premier Dominic Perrottet redrew the roadmap out of lockdown. To our reporter in Sydney in just a moment, but first let's take a look at the most recent coronavirus figures from New South Wales. There were 587 locally acquired cases reported yesterday and 8 deaths. And the state's 7-day infection average continues to trend downwards ahead of restrictions easing on Monday. 70.3% of people aged over 16 are now fully fully immunised, while 89.4% have received their first shot, and nearly 11 million vaccine doses have been administered in the state. Our reporter Manaz Angri joins us now from Sydney with more details. Hi there, Manaz. So take us through the changes.
Hi Ross, so Monday is the day that we will be entering stage 1 of New South Wales roadmap out of lockdown, but the restrictions in relation to that have been updated. So caps for visitors in the home, outdoor gatherings, weddings and funerals have been increased, and indoor swimming pools will also be open from Monday. Then once we reach the 80% milestone, masks in offices will become optional, nightclubs will open but dancing will not be permitted, and outdoor events will be able to take place at 3,000 people, provided they are ticketed and controlled. There's also been some changes in relation to schools. That was supposed to happen in 3 stages initially, but now it's moved to 2. The first stage will remain the fact that kindergarten, year 1 and year 12 students will go back to face-to-face learning on October 18th, but the week after, on October 25th, that's when all other grades will be able to join them.
Manaz, there's been some mixed reactions to these fast-track changes.
That's right. For schools, the Education Minister did welcome the move to bring the date forward, but teachers are not so happy about it. So there are concerns from teachers who say they weren't consulted about the changes at all, and they found out about it through the news. They say that bringing forward the date could risk HSC exams, so they're pretty concerned about that. And they're also concerned because it seems that only 85% of teachers will be fully vaccinated by October 25th. We've also had some feedback from the Australian Medical Association. The AMA president has said that opening up too quick and too fast could lead to a spike in cases and in turn lead to high rates of hospitalisation. There's also been some confusion about the idea of day trips between the metro and the regions. Yesterday, a spokesperson for the Deputy Premier told the ABC that people in the metro areas will be able to travel to the regions for a day trip for non-essential reasons. This caused some criticism with the Shoalhaven and Illawarra mayors saying that this was just a disaster waiting to happen, especially considering that there are a lot of the parts of the region that have not yet reached that 70% milestone. But it seems like the Deputy Premier portal has sought to clarify that this morning.
It is a little bit grey at the moment where people think they can do day trips. It will be cleared up today very clearly to say black and white that you can't go from Greater Sydney into the regions, and you cannot go from a regional community into Greater Sydney.
So we will hear more on that at today's public health order. A lot to look forward to for New South Wales residents, but there have been mixed reactions for what we're about to see on Monday.
Sure, more details to come then. Manaz, thank you. Well, more cases have been linked to a growing cluster at a special care nursery inside a hospital in the ACT. Reporter Lisa Glenday joins us now from Canberra with more details. Hi there, Lisa. So what are the latest COVID numbers in the Territory, first of all?
Good morning, Ros. Well, the COVID-19 numbers here in Canberra continue to bounce around. So we saw 41 new cases recorded yesterday, and unfortunately, more than half of those are yet to be linked to known cases. We've seen an increase in the rate of hospitalisation here in Canberra. We now have a record 15 COVID patients being treated in hospital. We've got 7 people in ICU, and unfortunately 6 of those are now on a ventilator. So we are expecting to see that hospitalisation rate increase in the coming weeks. Obviously, as restrictions begin to ease, we'll see an increase in cases and an increase in those patients presenting to hospital for treatment. We've now got more than 1,100 cases linked to this current outbreak here in Canberra, with about 400 cases still active. Now, what is of increasing concern to health authorities here in Canberra is this growing cluster that's linked to a nursery at Canberra Hospital. Now, at this stage, it's still not known the source of the infection, but we know that 2 babies have tested positive to COVID-19, as well as 2 visitors to the hospital and 1 staff member. So that's obviously a concerning situation for health authorities, and also a real concern for pregnant women in Canberra who are expecting to give birth in the coming days.
How are the vaccination rates going there in the ACT, Lisa?
So pretty good, to be honest. So we now have almost 100% of Canberrans aged 12 and over who have received a first dose. So as of yesterday, we had more than 96% of Canberrans having received that first jab, which the Health Minister says is pretty astonishing. I don't think they were expecting vaccination rates to be quite so high. And Canberra is on track to become one of the most vaccinated cities in the world against COVID-19. So like New South Wales, we have reached that double dose vaccine milestone of 70% for those aged 16 and over. But here in the ACT, they are focused on the whole eligible population. So they're counting people aged 12 and above. So we're still a few more days off reaching that milestone. We're now in week 9 of lockdown here in the ACT, and we've still got one more week to go until restrictions begin to gradually ease. But the bulk of restrictions here in Canberra won't be easing until the 29th of October, so we've still got a few more weeks to go. But health authorities are going to be keeping a close eye on the situation in New South Wales because, as we've just heard, we've got a lot of restrictions easing from Monday, and of course, there are a growing number of cases in the southern part of New South Wales, and of course that area relies heavily on the ACT's health system, particularly the intensive care unit. So ACT health authorities will be keeping a very close eye on the evolving situation in New South Wales, and then will respond accordingly.
Lisa, thanks for that. Eased restrictions might be on the table for Mount Gambier in South Australia. Reporter Charles Bryce joins us now from Adelaide. Good morning, Charles. Authorities are meeting this morning to discuss what's happening in Mount Gambier.
That's right, Ros. The State Transition Committee will be getting together at 10 a.m. local time. They're going to be discussing the potential easing of restrictions in that Mount Gambier region. We did see restrictions come into place on Monday for the Wattle Range, the Mount Gambier and the Grant District Councils. That meant that density limits were restricted to 25% and there were caps on personal gatherings of just 10 people. Authorities are confident that if they do ease the restrictions, that won't pose a threat to the community. There has been no community transmission of the virus, and there has only been one exposure site listed. That is the Sip and Save bottle at the Southeastern Hotel in Mount Gambier. An investigation into the movements of the woman who had tested positive in Mount Gambier is almost complete, although SA Health are saying that they won't be releasing those details unless there is a risk to public safety. And that's caused a bit of mixed emotions within the community, Ros. We've heard from people saying that they're quite angry and it's making them quite anxious, not knowing just exactly where this woman had been, while others are pretty confident in SA Health.
And Charles, healthcare workers there have been given a deadline to get their first jab.
That's right, and the deadline isn't too far away. This is after a new direction came into effect last night. It'll mean that anyone that is working in the healthcare, from admin staff to cleaners and also students, will need to have at least their first dose of the vaccine by November. They'll also need to have evidence that they've booked in for their second dose at least within a month of having their first. They'll also need to provide evidence to the employer that they had about their vaccination status if requested. This has come after National Cabinet accepted plans to mandate vaccinations for those people working in the healthcare system.
OK, Charles, thank you.